women's face, face the women. And the last part, we should face the foot of her. And then before we do it, we should always let her to empty her bladder and to make sure that the environment is comfort, and then let the other people get out of our exam room. Yeah, it's okay. And now talk to the patient that I talk to the woman that I will do the test for you to make to know about what you should to describe it, to know about the size and the if the size is comfort of the gestational weeks, and to know about the position of the baby. And then now we do the first part. At first, we will use our two hands to to palpate the woman's upper abdomen. Yeah, we will both hands, and then you can always determine over the size, the shape, and mobility of the form. And you should know that for the fetal head, it's always hard, round. You can touch your own head. Yeah, it's hard and round and moves independently. Yeah, and for the limbs, for buttocks, it feels softer, and symmetric. And the shoulders and limbs have small bony, and then unlike the head, they usually moves. For the head is hard and just like a ball. Okay, and then is the second part. Second part always use our both hands. And after the upper abdomen, the two sides to find out the location of the fetal back and the limbs and the fingers, And for the fetal back, usually, and we can always for the one hand, you should have deep pressure with your palm, and then touch it. Touch it gentle. But you should use the deeper pressure. But if you don't have deeper pressure, you cannot touch clearly. And then after do this hand, you can see, to find out where is the fetal back and where is the fingers and limbs. For the fetal backs, it always feel smooth and firm. And do you know where to for us to hear the fetal heart movement? Do you know? Just the fetal back. Yeah. And for the fingers and limbs, you know that it always have small bony processes, and you always move. And this is the second part. And for the third part, use one hand, and the thumb and two fingers. The four fingers should, just like this, and then put it here, the lower abdomen. With the thumb and fingers of the right hand. We usually use the right hand. Here say that if the woman enters labor, this is the part which we most like come first, in the vaginal birth. So make sure if here is the fetal head or the buttock. And usually in our country, if it is buttock, we usually suggest she to get the C-section. C-section. And to make sure that if it can move or cannot move. This is the third part. And here comes the last part, the fourth part. The fourth part, we should turn to the foot and use always two hands. Just come here and you pressure it in a hard pressure to recheck of the
feet head or
and to make sure that if it cannot move. Okay. I will see what is important. If the head of the fetus is well flexed, it should be on the opposite side from the fetal back. If the fetal head is extended though, the occiput is instead felt and is located on the same side as the back. And is there anybody know about the normal heartbeat of the fetal? Normal heartbeat, the range?
Less than 60.
No.
Highway.
Fetal distress 110. 60 to 80.
More than 100.
110.
Actually, the range is the 110 to the 160. 60. You should remember it. Maybe the teacher will ask you the question. No.
Yes.
And when the baby gave birth to the baby, do you know how the range?
92.
It should upper than the 100. And if it's always upper than the 160, it may be, or lower than the 100, it may be have
Fetal
some,
distress.
yeah. Okay. And do you have any questions?
No.
No.
And some of you can practice this part. You just because it's easy, then by manual. And then if you have some questions, you can ask me here to translate it for you. And I will check the by manual for other students. Okay. You just remember first 4 parts, and for the 1/3 part should face the face, and the last part is face to the feet. Yeah. And we usually use 2 hands for the 1, 2, and 4th, and for the 3rd part use 1 hand. Okay, the right hand. Okay.